most of my patients I got to know. The more I knew them, the more involved in the surgery I became, obviously. It's a bit of a scary tightrope because this surgery does have complications, and these complications can be major. You can have major bleeding. You can do major bone damage. You can paralyze people doing spine surgery. So that's sitting over here. It's technically demanding in that there's lots of little fiddly things to do and you have to do them all right. And so that the technical part of the operation requires a fair amount of attention. And so you tend to start off focused on everything. And then as the surgery goes along, you focus in on the minutia, because everything has to go in line. And then once you get that, then you can broaden your focus again. In the OR, there's a team. I mean, this isn't a surgeon sitting there doing it. I couldn't do the surgery that I did in other hospitals because the team was at Children's Hospital. So the anesthetic team that could give a beautiful anesthetic, take people down lightly, control pain as they're waking up, keep the blood pressure where it should be so my blood loss was small. Really hugely important. The nursing team that knew what I was going to do next, so I didn't have to keep turning around saying, oh, hey, that instrument over there, so then it would break my focus. So, they're there to make sure that things go right. We can tell how the spinal cord is working when a patient's asleep. We can stimulate the sole of the foot with a little tiny electric current, and we can pick up that electric current in the brain. We can stimulate up here and pick it up down on the foot. And that says that the spinal cord is working. Well, this is a spine procedure. Paraplegia is a risk. So this little group of what I used to call my guardian angels would be there telling me, you're okay, it's going all right. And because you can't tell patients asleep, they're not going to say, hey, by the way, I'm having a little trouble moving my foot now. So it's a big event, lots of people, lots of attention to detail by everybody. It can last anywhere from 4 to 8 hours, and you don't even notice the time go. You start, and then you finish, and you say, oh, it's 4 o'clock in the afternoon. Isn't that interesting? And the fatigue hits you later.